Hello, everybody. My name is Kendra, and we also have Follow Me will be Christine, and then Viola, and then Serena. And we're doing a team project that will be dealing with promoting a policy, seeing if we can get our policy goers and the politicians to affect some change. So, what we're actually looking at is seeing if we can get more nurses in the schools, actually appropriate staffing of nurses in schools with an appropriate ratio. I'll be covering points A, B, and C. So when we start with the summary and who it impacts, when we look at public schools, they actually don't have appropriate staffing of nurses or sometimes don't even have a nurse in the school at all. When we look at who this is impacting, it's really impacting our children. Our children have injuries. Those are things we can account for, but we have more and more children who also have chronic conditions. It also is not just impacting our students. It's impacting their educators, the staff in the school. So educators, teachers, principals, assistant principals, and the clerical staff. Those are the people who step in the absence of a nurse and take care of our children from a medical standpoint. And while that is greatly appreciated, that is not what they went to school for. And then when we look at the impact on the nurses who are doing the job day in and day out, without the appropriate ratios, which we're going to talk about a little bit more, we have nurses who are both overworked and overwhelmed. When we look at the ratio that is set out by the National Association of School Nurses, that for a well group of students should be one nurse to every 750 students. You have students and nurses, or nurses who are dealing with ratios of one nurse to maybe 3,000 to 4,000 students. You can see how they can be quickly overworked and overwhelmed. When we look at the background on this issue, you have DENISCO, who in 2014 said only 45% of public schools have a full-time RN nurse in those schools. When we look at this, again, the National Association of School Nurses says, hey, for schools and nurses, if the children are well, it should be one nurse for every 750 students. Again, we know that in most of our schools, we're not dealing with a school full of healthy children. The National Association of School Nurses also accounts for that and then says, hey, we should lower that ratio to one nurse for every 225 students if we have students that require daily professional services. And we do have a lot of students who do. Coming to the nurse on a daily basis to check their blood sugars, to discuss carb counting before they go to lunch. And then if we have students who have, complex health issues, the National Association of School Nurses suggests that we drop that ratio even further to one nurse for every 125 students. And then when we look at students who require continuous need, as some of my classmates are going to talk about trach care and in and out calves, that will require a 1-to-1 ratio. And again, we are not seeing that in our school systems. Again, when we look at the impact on it, data by Bache, Ludine, and Murphy in 2011 has shown that when we do have a nurse present, students are both healthier and have better attendance. And again, if we're talking about the impact on school, you can't learn if you're not in school. There's a follow-up on the different conditions. When we're looking at them, a lot of times you have students who may get injured, and you have a teacher who may take care of it at that particular incident, but they're not going to follow up on it. Again, their daily goal is to educate the student, not typically to take care of the injuries. When you have a nurse, typically if we see the injury a couple days later, we're going to follow up on it. Again, we have more students with chronic conditions, asthma, type 1 and type 2 diabetes. Also, these students who have anaphylactic reactions, when we look at the number of students who are walking around with EpiPens. Again, more injuries are treated. More counseling occurs for both physical and psychosocial conditions. And when we look at the amount of time that's saved by our teachers and principals, assistant principals, and our clerical staff, nurses from the study were shown to save them 13 hours of medical attention time when a nurse is present. So when we move on to the third point, C, of what are these standard policies? How are we looking for the policies to change? The fact that there isn't a standardized policy is the issue. When we look at it, different counties and different states do different things. In some places and states, you have nurses who are a part of the school system. In other places, the nurses are hired as public health nurses by the county. In other states, the school's nurse doesn't actually work as the nurse. She works as a consultant. So we don't really have standardization of how the nurse is going to be used in school systems throughout our different states. And also, when you look at Danisco in 2014, she actually pointed out a major issue, which is some states are actually cutting back on our nurses. So again, this is an issue that has to be addressed. And Christine is going to take over next.
So we pick up on alternatives if we do nothing about this problem with school nurses. So, according to Guttu et al. In 2008, there is a significant correlation found with the increase of school nurses and the services provided to students with diabetes, asthma, and schools with better ratios of students and nurses have better outcomes for conditions such as depression, unintended pregnancy, and follow-up to school-related injuries. We know that school nurses are better for our students as in continuity of care. The same watchful, observant, trained eye watching over the same group of students day after day provides better outcomes, according to Guttu et al. Now, we know that the school nurse is not always present in the state of North Carolina. We have many schools that have a shared nurse, one nurse for 4 schools. We propose that this is a policy that needs to be addressed. We cannot continue to do nothing. We know that for one school nurse, sorry guys, I'm having camera issues. For one school nurse, we know that can care for 4,000 students when we have sicker students coming to school every day for their education. So we need one school nurse to take care of the children under her care consistently. One school, one nurse. Now, for smaller schools, a part-time nurse would be a viable option and should not be ruled out. But for most schools and the amount of work that is provided for one nurse with all the students with chronic conditions today, it would be best to have a full-time employed nurse. If we continue to do nothing, children continue to be at risk. Students are better served, as we know, by the observance of a trained eye daily, working in conjunction with primary care providers and parents of these students. The CDC espouses the same, that school nurses serve a viable function and the outcomes are better for students when a school nurse is present. Now, we know if we do nothing that we continue to have these problems. So we propose one school nurse for each school. We propose that the students that have chronic conditions, asthma, diabetes, epilepsy, and students that have mental health issues, they need constant daily supervision. And remember, we're working in conjunction with primary care providers and the parents. Now, we know the implementation of this alternative costs money that needs to be county, state, or school system derived. This is all about the bottom line. Nurses, as we will be told by Viola later, they are not in this profession for the money. They're among the lowest paid RNs that you can find. They have a huge responsibility and a huge workload. But we do know that we can find good nurses to care for these students if we simply have the monies to pay them. Now, implementing this alternative, we're going with the support of the CDC and the American Academy of Pediatrics when we say that the school nurse is important and vital for the best outcomes of these students. A trained and observant, watchful eye. Such public health issues such as lice, scabies, impetigo, streptococcal infections are all found to have better outcomes and a reduction in outbreak, according to the CDC, when a school nurse is observing and present. Now, implementation of policy change. We know that the outcomes will be better if we have a school nurse present in every school. So those are the 3 points covered, and I think Viola is going to take it from here.
Yes. So there are 3 disparities that I'm going to go over as far as the advantages of the change. So the 3 are mental health issues, obesity, and diabetes. So just with mental health issues, Baird 2015 said 1 in 5 children will have mental health issues that need support, whereas 1 in 10 children will be diagnosed with a mental health disorder. The World Health Organization argues that there is a need to promote mental health education amongst children, young people, and their families. School nurses are optimal. They're in the best place in order to be able to coordinate and collaborate this care. They can provide health promotion, they can provide the education, and then they can have early identification and intervention for these mental health illnesses. Next will be childhood obesity. Childhood obesity, Quilly 2014 says 1/3 of U.S. children between the ages of 2 and 19 are overweight or obese. And because these children spend 1/3 to 1/2 of their days in school, the school nurse is the one who is instrumental in starting the obesity program, collaborating with the school dietitian, and meeting with the parents in order to be able to begin an obesity program. They can provide nutrition education, they can assist with a physical activity regimen, and also with healthy lifestyle education. And then there is the diabetes that we are experiencing, the surge in diabetes. West 2014 said the most common form of diabetes is diabetes type 2. Well, you know, way back when I first became a nurse, diabetes type 2 was only diagnosed in older people, and that was because they were overweight. More and more, that diagnosis is occurring in children. 8 to 45% of new onset diabetes 2 is in children. 2002 to 2005 showed that we have 15,600 children with diabetes. But since 2010, we have 215,000 students that have been diagnosed with diabetes. That's an astronomical increase in the numbers of children that are diagnosed with diabetes. You know, the nurses there to provide that glucose monitoring. They're able to assess the medication. They're able to assess the patient or the student prior to the medication administration and following the medication administration. This is not something that school teachers are taught. They are not taught to come in and to take care of the medical needs of the children. The nurses are competent with the medical equipment. They're competent with the AED. They're there to provide a weight management program, and they have and they understand what the optimal blood glucose level is for learning. Those are the advantages. The disadvantages, however, are that, you know, the teachers don't have any action. They really are not taught how to assess a disease process. They're not taught to assess schizophrenia. They're not taught to assess diabetes. The inability to assess the patient, the students prior to the med administration and post med administration. They're not taught to do that. They have the inability, you know, a lot of times, I mean, most times they have the inability to recognize an emergency. And so when there is an emergency, you know, the nurse can hone in, know exactly what to do, and to provide that care in a very timely, effective, efficient manner. And also, you know, just a small thing, which is really not a small thing, of insulin administration. You know, in the hospital setting, it's such a high-risk medication that the nurses you have to witness what another nurse is giving to a patient, and then we're gonna hand this over to a teacher who's not really been taught how to administer this medication in an efficient manner. Now, the cost of the policy change. So what I did was I just looked at the state of North Carolina just to provide an example. So in the state of North Carolina, the average salary of nurses is $298,000. So we have 2,526 schools. So if we just put it at an average, the salaries of these nurses would be $116 million, $948,748. So that would be averagely what we would be paying. And the way that we can get this is just through policy change. We're paying taxes every day. We need to. That needs to be one of the most important things that we place in Congress's hands. The feasibility, it is feasible. It's very feasible to be able to do this. The only issue that I see right now is the nursing shortage that we're coming across. The process for evaluation of the change is that, initiating the program, we can evaluate the BMI, we can evaluate the mental health disparities that come along with it. We can evaluate how they're doing on their medications prior to and at the end of the program. We can evaluate their height and their weight at the beginning of the program and at the end of the program. The diabetes management, we can evaluate the A1Cs at the beginning and at the end of the program. So those are ways that we can evaluate the change. Now I'll hand it over to Serena.
Okay, so the policy supporters that we have are the National Association of School Nurses, the American Academy of Pediatrics, the National Association of Elementary and Secondary School Principals, the CDC, the Secretary of Health and Human Services, and of course parents. I found that 2 representatives, Carolyn McCarthy from New York and Lois Capps from California, have introduced the student-to-school ratio improvement bill in 2008, and this grants states to reduce the student-to-nurse ratio. So we'll need Congress and state legislatures to pass laws and bills so we can reduce these numbers and get money to pay the nurses. So in summary, because of the Education for Handicapped Children Act of 1975 and the Individuals with Disabilities Education Improvement Act of 2004, there are more sick children in schools. And the nurses can't handle having these huge ratios and taking care of the whole school when they have to do one-on-one care with these sick children. Students that have chronic conditions such as asthma and diabetes, they require health care at school, and it's increased significantly. And with this increase, staffing that can lead to inconsistencies with the care of the students. And according to Dolowski of 2015, there are 33 states that currently have provisions for school nurses, and 14 of these have established student-to-nurse ratios. To optimally care for children, preparation and ongoing education and appropriate staffing levels for school nurses are important factors for success. Thank you for watching our video.